What is the trachea and lung anatomy? Have you ever wondered what the trachea is and why it is so important for our lungs? The trachea, often called the windpipe, is a crucial part of our respiratory system. It is a rigid tube that connects the lower part of the larynx, or voice box, to the lungs. This tube is about 9 to 15 centimeters long, which is roughly 4 to 6 inches. The trachea is the main airway that allows air to flow in and out of the lungs during breathing. Anatomically, the trachea is part of the lower respiratory tract. It serves as the central trunk of the tracheobronchial tree, which includes the bronchi and smaller airways within the lungs. The trachea starts at the bottom of the larynx and extends down to the sternal angle, where it splits into the right and left main bronchi. Each of these bronchi enters a lung, marking the beginning of the bronchial tubes that branch out into smaller airways. The structure of the trachea is quite fascinating. It is supported by 16 to 20 degrees Celsius shaped rings made of hyaline cartilage. These rings help keep the airway open, preventing it from collapsing during breathing. The open part of these rings faces the back, where a fibromuscular membrane and smooth muscle provide some flexibility. This design allows the trachea to accommodate the esophagus, which lies just behind it. The wall of the trachea has several layers. The innermost layer, called the mucosa, contains ciliated epithelium. This special lining helps trap and move foreign particles upward toward the throat, which protects the lungs from infection and irritation. Additionally, the trachea warms and moistens the air before it reaches the delicate tissues of the lungs. From a lung health perspective, the trachea is vital because it is the main pathway for air to reach the lungs. Any issues like obstruction, inflammation, or even cancer in the trachea can significantly affect breathing and lung function. Lung cancer can sometimes involve the trachea or its branches, either by direct tumor invasion or causing airway obstruction. This can lead to symptoms such as coughing, wheezing, or difficulty breathing. Understanding the anatomy of the trachea is essential for diagnosing and treating these conditions effectively. The blood supply to the trachea comes from branches of the inferior thyroid artery and bronchial arteries. Venous drainage occurs through the inferior thyroid venous plexus and bronchial veins. The trachea is also innervated by the pulmonary plexus, which helps regulate airway tone and reflexes. In summary, the trachea is an essential airway that connects the throat to the lungs. It is supported by cartilage rings and plays a vital role in conducting air, protecting the respiratory tract, and maintaining lung health. Understanding its anatomy and function is foundational for grasping respiratory diseases, including lung cancer. Always remember, if you have concerns about your lung health, consulting a healthcare professional is the best course of action.